we advertise this as a live, live stream, just ask questions of anybody wants to ask us questions. And so you've got a brain surgeon and a heart surgeon sitting in front of you. So if you guys have questions, we can try to answer them for you, and we can talk a little bit about a few things too. But Kevin's here going to pull some questions out.
Yeah, if you see any, I know it's hard to track them sometimes
because the questions come so fast. Hi from Pakistan, nice. Ocala, Florida.
Person said, what is the thing that you think a medical student who wants to be a neurosurgeon should do?
I mean, if you want to be a neurosurgeon, and then maybe we can comment on heart surgery too, but I think it might be similar. First thing you got to do is just you got to get through high school, then 4 years of college, get a college degree, then you got to get into medical school and then into a residency. So it's a long haul. But the main thing you got to do is decide that's what you want to do, because if you want to do that, then you got to go all in. You got to study hard, put away the weekends of partying, and you got to really study hard, get good grades. And that's the way you're going to do it to get into a good medical school and a good residency program. So it's discipline and long hours, hard work. What do you say, Jeremy?
Totally agree. You're looking at 13 years to be a cardiac surgeon, just starting in college and working your way through all the way through residency. It's certainly a level of dedication, and you got to be willing to put yourself on a specific track, sure. And, it's tough because you don't truly know what it's going to be like when you get there. But you have to kind of keep the eyes on the prize.
Yeah. It's definitely scary too. I mean, I remember I was getting ready to sign up for neurosurgery residency, and I'm thinking, God, can I do this? And you're just thinking about, can I really operate on somebody's brain and, do all these crazy hours you hear people talking about? So it is scary. But was it as bad as you thought when you got into it?
No, it was not, because,
Can you not hear me?
Yes, I can. Yeah.
Okay.
You asked me if it was as bad as I thought.
Yeah.
I had actually planned on being a family practitioner, and that was my goal, to be like in the North Georgia mountains as, the only physician about 200 miles in radius. And I did a ruptured aneurysm in the middle of the night one night and like totally switched gears and said, I want to be a surgeon. But I didn't know what kind, but I was positive I didn't want to be a heart surgeon, because I didn't like those guys, to be honest with you. And then I scrubbed my first heart surgery, and I was like, oh my God, this is it. This is what I want to do. And from that point on, I never turned back.
I saw a question that just came across, says, do either of you have fast cars so you can get to the hospital quickly?
I drive a truck.
Yeah. I drive an SUV too. But have you ever ran a red light to get to the hospital?
I have, many times.
Yeah. And I was stopped once by a cop. I was, it was emergency, and I was speeding, and they stopped me, and he just said, get to the hospital. He stopped me and said, get to the hospital. But people always ask me, like, do you have a siren on, a siren and a light on your car because you're a neurosurgeon? The answer is no. We don't get treated much differently than anybody else, honestly.
No, for sure. I was driving to the hospital in between hospitals on New Year's Day one year, and I had a patient that was already in the operating room, and I got pulled over by like 3 cops at one time, because apparently my tag had expired and I didn't realize it. And I didn't have my registration in the car. They thought the car was stolen, and I had to convince them that the patient was asleep in the operating room and I needed to get to the hospital. So one of them actually followed me to the hospital to make sure that's where I was going. And that was not fun. I thought it was on an episode of Cops, to be perfectly honest with you.
What else we got?
This for both you would be, what is your favorite activity for decompressing and keeping a good work-life balance?
Go ahead, Brian.
I like being outdoors. So, I mean, I love doing work around the yard, cleaning up the yard and keeping it nice. And then my second thing would be golf. I really enjoy golf. So it's time consuming, but when I get a chance to do it, I like to do it. But definitely being outdoors.
Yeah, absolutely. I love being out in the woods in particular. And I love working out. Like that's my, my primary go-to for decompression, for sure.
Yeah.
How many years of schooling did it take each of you to get where you are today?
Go ahead.
4 years of college, 4 years of medical school, 5 years of general surgery, and 3 years of cardiac training.
Wow. So mine was 4 years of college, 4 years of medical school. Then I did a Howard Hughes Research Fellowship, which was extra, and then 7 years of residency. So pretty close. I think he got me by a year there. Maybe, I don't know.
You're smarter.
Huh?
You didn't take it. It didn't take as long.
Is there ever a situation where you travel to another hospital to perform an emergency surgery?
To another.
Go ahead.
Like,
I think they're just meaning like somewhere you're not like on call, maybe.
oh yeah. I mean, for me, if I have an emergency, it's usually the hospital I work at when I'm on call for. It's like this Friday, I start trauma call at our healthcare system. So I mean, I will do emergencies at those hospitals, but not a different hospital that I don't normally go to.
Yeah, same for me. Years ago, I covered 3 hospitals at one time on call, one of them being a trauma center, and actually it was not appropriate. And now for the last 7 or 8 years, I've been in one hospital, and it makes a lot more sense because I can dedicate my time there, both
Yeah.
to emergencies and
Yeah.
non-emergencies.
And that's something that maybe people don't even know about. Like, you're probably much the same. When I first started on practice, so many hospitals want you to operate their hospital because, we generate, I think, income for the hospitals and they need our services. So, I mean, I would operate at 4, sometimes 5 different hospitals in town. And I remember getting up at 3:30 in the morning to go to one hospital, see my patients, then you go to the next hospital and then the next hospital and finally make it to office by 8. And so I'm down to just several hospitals now too, because it's too much driving around. It's too much downtime. You never see your family because you're always driving around trying to see people at other hospitals.
For sure. When I first came to town, we were actually trying to start a heart program that was about an hour away. And there were 3 of us in the group at the time. And we would stay over there and rotate operating and going back and forth. So I was basically gone for about a third of the year at a time. And it was just too hard on my family. We had to back out. And from a clinical standpoint, you do an operation, round on that patient. If they weren't doing well, you're like trying to manage them over the telephone as you're going down the highway. It's not good medicine.
Yeah. What is the longest surgery each of you has performed?
Go ahead, Brian.
So for me, the longest surgery that I personally performed myself would probably be a 15 or 16 hour, big brain tumor. In residency, I think we had longer cases, but I wasn't the primary surgeon. I was a resident. But as me, the attending, doing the surgery myself with no one else in there, 15 to 16 hours.
Yeah, for me, since I've been in private practice, it's about 10 hours doing an aortic dissection.
Yeah.
Wow, those take that long?
They can't. This one did. Yeah.
I'm kidding. The radiologist can do them like in an hour, can't they?
Different kind of dissection.
Do you ever find yourself battling insurance companies, or are a majority of your cases easily approved?
Oh, I don't know if you have that experience. We have that experience all the time. I'm battling insurance companies constantly, and because they'll end up canceling a person will be all scheduled for surgery for 2 to 4 weeks or even longer, and then the day before they'll want to have a call with me saying the patient maybe hasn't been through physical therapy or something like that, and they'll literally cancel the surgery the day before when the patient's family is in town. They've taken work off. We've got the hospital time. So we have that happen frequently, actually.
The majority of my cases and the patients that I see are actually inpatient in the hospital. And so they don't have to go through a pre-approval process. But about 40% I see in the office as elective cases. And I think the pre-approval process in concept early on was great. But now I think it genuinely impacts patients' care because it pushes the timeline so long inappropriately because the insurance companies don't want to pay.
100%. And it's so disruptive to everybody else but the insurance company. It's disruptive to the hospital. It's disruptive to the patient and their families. It's disruptive to our schedule. But the only one that's not disruptive to is the insurance company.
Absolutely.
This is interesting. Blood pressure affects your brain? ? Can that look like MS? You know, any thoughts on that?
So blood pressure, if you have constant high blood pressure, it certainly can affect your brain as far as on an MRI. It can show have white areas in your brain that can look like MS. So I guess in a way, high blood pressure on a chronic basis potentially could show up on an MRI and maybe mimic MS a little bit. So any thoughts on that, Dr. Lundy?
You're out of my wheelhouse on that one.
Are brain aneurysms hereditary?
Usually they can be. I mean, there is some genetic component to it. If it runs in your family, certainly you have an increased risk of having one, but I don't think it's not purely genetic. No.
Yeah. How do you each handle eating and during a surgery day?
I just watched your video on that. What you eat during surgery day, Mr. Health. Go ahead.
So typically, I'm a cup of coffee or cup and a half of coffee in the morning, and something super light before surgery, and then something relatively light for lunch, salad with some protein, and then a snack during the day. But I don't like to eat a whole lot before I end up in the operating room.
Yeah, I'm the same way. When I get up in the morning, like I may have a cup of coffee before I leave, or part of a coffee, and then I don't usually eat breakfast. I don't know. I never have much, and so when I get done with my first case, it's usually a longer case, maybe 3.5 hours, and I'll usually eat around 11 or something, 11:30 when I get out, and they have like little sandwiches and snacks that I'll eat between cases, and if there's a fruit, I'll have some fruit, but there's junk food there too, so I'll have some chips occasionally and stuff like that, and then I'll just snack in between cases. I mean, if it's in between a case, I eat a quick whatever they have in the doctor's lounge. I usually don't pack on surgery days.
Given the nature of your professions, how do you manage sleep deprivation?
I don't know. I've been asked this question before. I mean, I think, and you can give me your opinion. I think you just get used to it. Like people say, well, how can you operate the next day on people when you've been up all night? And I don't know. I think you have to learn your limits. And we did so much of that during residency. Your body becomes trained to it. And if I was ever in the position where I thought I was so tired that I couldn't operate because of sleep deprivation, I would cancel the surgery. And I've done that occasionally. Like if I've been operating all day and then all night on traumas, and then the next day I have cases and I don't feel like I can operate, I go to the patient and say, I'm tired. I've been up all night. They never say anything. I think they appreciate that I cancel their case. But sometimes I feel just fine. I mean, you have to know your body, and I know my body, and I know what I'm capable of, and I'll never put anybody at risk if I feel like I'm too tired. How do you feel about it?
Absolutely. I handle it exactly the same way. Have you ever had a patient or the family get mad at you for canceling because you went in to tell them that you were too tired?
I mean, they've kind of gotten grumpy a little bit, but when I'll just reiterate, that I've been up all night, and
Same.
I think it's in your best interest, and they'll back down and say, well, we appreciate your honesty, but they're probably not happy that they're canceled. But if anything went wrong, and I told them I was up all night, can you imagine how that would go?
Absolutely. Yeah, I've had it happen one time to the point that they asked for another surgeon.
Wow,
Actually.
that's crazy.
And my comment was, you know what? I think that this relationship wasn't going to work. If that's how you feel about me making a responsible decision, probably best you find another surgeon. But everyone else is always appreciative that we're not going to. So then usually you go home and sleep for a few hours, and I just move the case a lot of times. 4 or 5 hours later, it's still done that day, just not in the mornings.
Yeah.
This one's for you, Dr. London. It says, I don't know if you can answer, but any correlation between heart disease with Moya?
I don't know that I can answer that question because I'm not sure. I don't know the answer.
What that is.
Yeah, so Moya, it's where you have your blood vessels that enter your brain terminate into little tiny blood vessels.
Yes.
On an angiogram, they call it a puff of smoke because there's so many little vessels that light up. But I don't know if there's a component. I don't think so.
Either. I don't think so, but I honestly I don't know.
There's so many syndromes where certain things are, maybe there is.
So let's see. This is an interesting one. Have any of your patients had an outer body experience during surgery?
Wow. Not that they've told me.
There's that movie, it's like Awake. Talking about,
people ask that all the time. They'll say, "Have you ever had anybody wake up during surgery?" I say, Not that I know of, but people worry about it. You have, really?
One. 20 years ago,
Wow.
yes.
Oh
Could
wow.
hear, could physically hear sawing the bone, heard our
Wow.
conversation. It was not, it was terrible.
Wow.
Absolutely terrible. Yeah, couldn't feel anything, was not in any pain, but was conscious through a large portion of the operation.
That's crazy. I mean, we've done lots of awake brain surgery. We wake people up during surgery, but
Sure.
not to hit them unintentionally awake. Wow.
Yeah, it was bad.
If you have the opportunity to choose again, would you choose the same specialty?
Brian?
Oh, I would definitely choose the same specialty if I was going to go into medicine. And yeah, I mean, I think neurosurgery is really cool. That's what I liked about it. I think it was one of the most challenging fields that I could think of to challenge me. And I think it's really interesting. I think it's a cool field. You probably feel the same about your field, but yeah, that's the field I was going to again.
Yeah, I think so. I think it gives me the mix that I really enjoy, which is taking care of relatively sick patients, doing a lot of critical care medicine and some really intricate operations. And it's hard to find that mix in other specialties.
Yeah.
This person said, have you all met outside of social media? Dr. London performed open heart surgery on my husband a year ago. We can't say enough good things.
Wow.
Well, that's very nice. I'm glad they're doing well.
Yeah, you guys
No.
like a month or two ago?
Yeah, we met just like
Over the phone or by FaceTime.
Yeah. Yeah, it was your son that contacted us through something, and I saw the message, and I think you left the phone number. Did I just call? I think I just called you.
You did. Well, what people don't realize, is that you guys are our social media heroes. Like if it wasn't for y'all, we wouldn't be doing this at all. So we reached out to tell you thank you for paving the way, and consequent to that, the relationship has really started, and we appreciate all the guidance and support. And we've enjoyed getting to know you guys.
You know, it's very interesting, all the similarities. Like you guys are almost the same age. Me and Max, your son, are pretty much the same age.
Yeah.
There's a lot of overlap.
For sure.
Difference between brain lesion and brain tumor.
I mean, a brain lesion can be anything. A brain lesion could be from an old bruising of the brain. It could be from, multiple sclerosis. It could be from infection. So brain lesion means, a lesion just means whatever, some abnormality of the brain, but a brain tumor is a brain tumor. So they're not the same. I mean, really.
Okay. Do either of you have a preoperative ritual?
What's your ritual?
You mean like right before we go into the operating room?
I think they're like referring to like some like sports people will have like a whole ritual. Like say a boxer, they'll wrap their hands a certain way.
No,
I don't know. Or have any.
I really don't. Mm-mm.
Well, you probably do. I don't know. Like my ritual would be, whenever I get in the operating room, I kind of set up what I need to have set up for my surgery, and then I'll go read my note to make sure I know what I'm doing with the patient, make sure I know what side it is, and then I'll always look at the films. And if I don't have the films, I cancel the surgery, because in case my dictation was ever wrong, I'm not going to do the wrong surgery. So that's my ritual, and I try to stick by it, because that way, thank God, I've never done wrong side surgery or wrong level surgery in 25 years. But that's how it can happen if you don't do those things. So it's not really,
Absolutely.
it's not really a ritual. It's a ritual that I do, but it's not like singing or anything.
Right. And that I absolutely, is
Right.
the first thing that I do when I walk in the door is I go to the cath lab and I look at my
Right.
films for the case that I'm going to be operating on, and kind of focus on that one patient prior to walking in the operating room. Yes, that I absolutely did. But I
And
don't
then you
like.
and then you go to the mirror. Then you go to the mirror and say, "You the man."
Tomorrow I'm going to do that. Yes, I'm going to add that to my ritual.
You
I'd actually like someone to say it to me.
you can do it.
So Max London said hi earlier. He said that's my dad.
Where's he at?
No, he was Reese London. Sorry,
Oh.
Reese London. No, just in the comment. And then Christy Cobbin said hi. Someone put reason for heart flutters that you could.
For heart flutters. Yeah. So those are super common, and we've We've done some newsletters on that. If you're interested, you can always kind of check out our bio for the newsletters to dive a little deeper in these things. But the first thing to know is that heart palpitations or fluttering, for the most part, are not dangerous at all. The only time that you have to worry or be seen by a doctor is if you're lightheaded or you're passing out or you're having chest pain or anything of that nature. But for the most part, it's usually caused by emotional stress, caffeine, alcohol, tobacco, things that you're doing to yourself, stress, etc., that cause those kinds of things, but they're rarely of concern.
Good to know. What music do you listen to in the operating room?
Primarily outlaw country.
Like, what is that?
Tyler Childers.
It's not Willie Nelson, is it?
No, well, a little bit. That's older outlaw country for sure.
You'll have to send us a song.
Whiskey Myers. And then some days the nurses have had enough of my music and I let them choose.
Good job.
How about you, Brian?
90% of the time, I just let the nurses put on what they want, except if it's something I just can't, like when they get into this rap stuff, I just have to turn it off. I can't take it.
What if you have one preference? What would you like? 80s music, or what would your top? If you
I usually do 80s. If it's my preference, I do 80s music, 70s and 80s for me.
Yeah.
But
usually, if we put it on the spectrum, that makes everybody happy.
Yeah.
On XM.
How do I ask a physician if I can shadow them and if they can write me a letter of recommendation? You guys have any advice?
You're talking about if it's somebody that you don't know at all, I think the best way is to contact them through email and then to see if it's even something that they do. And typically the hospital has some sort of program where, you have to go through a process so that the insurance for the hospital, et cetera, covers you. If you're in school, a lot of times the school can help you facilitate those kinds of things. How do you do it, Brian?
yeah, I mean, I don't have that many people shadow, but occasionally somebody will, and you just got to get the approval through the hospital. That's the big thing. And then they're very squeamish about having people come in the operating rooms nowadays, so you got to get around that hurdle. As far as the letter of recommendation, you have to work with somebody. Like, if I have somebody with me for a week and they're in the office with me each day and in the operating room with me each day, I think I can write them a letter of recommendation. But if I just see somebody for a day and work with them, I can't really write a letter of recommendation because I don't really know them.
Yeah.
And it's also, I would say, with people that reach out, just in any field, is like, don't be demanding. If someone, a lot of people are very busy, especially if you're further along in your career. Yeah. You can't expect someone to just do something for you.
I will give anybody out there listening, I don't know who asked this question, but I've had people shadow me and then they want a good evaluation. I mean, you have to be interested when you're there. So many people come through and they're just not interested. They'll come in late. They don't want to be there. You can tell they don't want to be there. But then they want glowing reviews at the end. So if you're going to ask somebody to shadow you, I mean, really be motivated about it. Try to take interest. Go home and read about the cases or read about what you see. I mean, I think it really helps if you want to get a good evaluation or a letter,
I agree.
Do you guys have a favorite movie or just maybe one of your top favorite movies? What?
I don't know. So many movies that I like. What?
It is. You don't watch movies?
There's lots of movies. I just can't think of it. Interstellar. I like Interstellar.
Mine would be Shawshank Redemption.
Great movie. Great movie. Have you seen Shawshank Redemption?
Yeah. Okay. It's kind of disturbing, some of the scenes.
Yes.
Very disturbing.
Have you ever run into a patient outside of the clinical setting?
Oh, 100%. Yeah, like in the grocery store or anywhere, it could be at the airport somewhere. Yeah, it happens not infrequently.
Yeah, pumping gas. That's the most common for me. Someone looks across as you're pumping gas and you know the face, but you're not sure if you operated on them or someone in the family and you're like, is everybody doing okay?
Yeah,
it is hard. I mean, I've learned at this stage in the game, I can't remember everybody, but I will just ask them. I'll just say, I just, your name's, I can't say your name, or what did I do, ask them. And I just up front, I can't, and they're pretty cool about it, but because I hate when you're trying to say, oh yeah, hi, nice to know them and you don't, then it's very awkward. So I just say, I don't remember. Can you fill me in? And they're very nice about it.
Yeah, I mean, I always tell them, I always remember the face, but I see so many people, I can't remember people's names and the specifics. So remind me. Yeah.
Somebody just asked a question: when you guys take a vacation, are you able to separate and enjoy yourself? And I don't know. As far as I'm concerned, it's hard to wind down. If you've had a really busy couple weeks, it's hard. The first 2 or 3 days of my vacation, I can't even relax because you're still wound up. And then by the time you relax, vacation's almost over. It seems like.
I totally agree. That's why they say the key to happiness is 2 weeks of vacation, which I've never done in,
Yeah.
all these years, because it gives you that first week to get there and wind down and get into vacation mode and actually relax. But my experience is exactly like yours.
Yeah, I've never done a full 2 week vacation, and it's really hard to come back after vacation and get
Yeah.
back in the swing of things. Boy, is it hard. So sometimes I'll make you feel, God, I don't even want to do vacation because it's so hard getting back into the swing of things. Because there is a mode to being a surgeon. Like when you're in that mode and you're busy and you're operating all the time, life is so much easier and
Mm,
confidence levels are high. And then you go on vacation, you come back, and it's like all of a sudden, it's like you gotta rewind everything up. It's weird.
yes. Vacation hands.
Yeah.
My sister asked in the comments, how was there a specific moment or instance that kind of led you on to being doing what you do, or was it just kind of an accumulation from shadowing and stuff, or did you have like, I don't know, just how she put it, just like
You talking about Christy?
yeah, like
Well, Christy wanted to be a heart surgeon at one point, so I think she's asking you that question.
no, she is asking him. She's not asking
Yeah.
you.
Asking,
Why would she ask you?
asking about heart surgery or going into medicine.
Um, sorry, I mean, I just lost it for a second.
Why
But
you wanted to be a heart
She said,
surgeon?
when did you realize you wanted to be a cardiovascular surgeon specifically? Was there a
Gotcha.
specific moment that led to
Yeah,
it?
for sure. I think a lot of times the specialties you pick, in addition to, being interested in the cases and taking care of that particular type of patient, it's the people that are in that specialty that you typically respect and you want to emulate the way that they care for that group of patients. And my mentors when I was in general surgery that were cardiac surgeons were phenomenal physicians, and I had a lot of respect for them, and I think that was really something that pushed me forward.
What?
Remember that one?
What does it say?
It doesn't matter what medical.
Oh, it doesn't matter what medical school you go to?
No.
Yeah, I would say no to it. It matters what grades you get and what you do while you're there. Because I didn't go to any stellar medical school. I shouldn't say that because they wouldn't want to hear that. But I mean, my medical school is probably an average medical school, but it really depends what you make of it. And if you
Absolutely.
get straight A's and do some research, you're going to be much ahead than someone who just graduates from Harvard with C's.
No. Do you ever, and how do you deal with self-doubt, if ever? You ever have self-doubt?
I mean, when I have self doubt, I just tell myself I've done this surgery 1,000 times, and people always do, really well. So why am I doubting myself? If it's a really big case, I just remind myself he's got to take it one step at a time. That's what usually
Exactly.
it's kind of interesting. I mean, there's some truth to it. I don't know about you, but when you see the patient in person and they're a person, it makes you worry a little bit. You kind of doubt things a little bit. But once the patient is asleep, you put all the drapes on. My attitude changes. It's like now it's an operation. It's a person, but it's an operation. There's a different feeling once you get started. Like once I get started, everything's fine. I don't know how to put it. It's hard to put into words, but once you're actually going and doing it,
Mhm.
everything falls into place. The anxiety goes away if there is any.
Yeah, I mean, I think you have to compartmentalize to some degree, like you said, when you're interacting with the patients and the families, you're given this opportunity to really affect their lives in a very personal way. And then when you get into the operating room, you have to allow yourself to take on a different persona almost. And like you said, I think that one step at a time to complete the operation is the key. Focus
Yeah,
on the step that you're on, not five
right.
steps ahead, or what the outcome is going to be.
Yeah,
And amazingly, the operation goes very fast, even if it's a long procedure when you do that. And I
yeah.
think you're very concentrated on each individual.
And that's definitely like anything in life. Like people who have anxiety. like my wife, she can have 10 thoughts in her head and they're all racing around to some extent. And I think that can make you feel anxious about things. But I think if you just think about one step at a time, like when you're on call, you have all these consults. Like I remember when I was younger and I was so busy, I mean, I get out of surgery after doing, 4 cases. It'd be 7 o'clock at night and I'd have literally 7 to 8 consults to see. It's mind boggling and your anxiety's up, but you just got to do it one step at a time, one consult at a time, one person at a time, one problem at a time. And then you get through it,
Yeah, exactly.
This question is, how is it determined with a trauma case which surgeon operates first if multiple organ systems are involved?
Good question. I mean, occasionally we've done it simultaneously surgery. I mean, I've had occasion where they've operated on the belly while I'm operating on the head.
How does that work?
Well, the patient's asleep.
I know, I'm just saying, like, how do you not, like, get in each other's?
It has to be, I'm at the head and they're down at the belly. I don't know how have you had it. Like, when you were a general surgeon, how did it work?
Yeah, I mean, I think it's a prioritization, right? Whatever the most life-threatening situation is, that's what's going to be addressed first. My father-in-law, who was a neurosurgeon for years, when we would walk into the ER together to see a patient, he's like, "Oh, this is bad. If they need a cardiac surgeon and a neurosurgeon, this is a bad situation." Right. But it just depends. Sometimes it is a collaborative process, with particularly with cardiac surgeons and general surgeons and traumas and what have you. And if you can address more than one problem at a time, all the better.
Yeah.
Cool. That was a good question, whoever asked that.
Well, it's a tough question because, I remember a case where somebody had an epidural hematoma, so had a blood clot over their brain expanding, had dilated their pupil, definitely were going to die, needed that surgery done right away, but also had an abdominal injury and was abdominal bleeding. And so both things were going on at once. I mean, you didn't really have a choice. One wasn't worse than the other.
That's tough.
Because they're going to die from one or the other, so you had to address both of them. The patient survived.
Do you have any thoughts on the sauna for your heart? The sauna.
Yeah, I mean, there is
sitting in a sauna.
They just said sauna, so yeah, I'm assuming sitting in a sauna.
Yeah, there is really, really good data now that shows that even limited heat exposure in a sauna can decrease your overall cardiovascular risk by almost a quarter. And I don't remember exactly what the weekly minutes are, but it's not much. It's a little different temperature-wise, whether it's an infrared sauna or a traditional sauna, what have you. But a lot of it just has to do with getting your core body temperature up and getting your heart rate up in the sauna, but it significantly decreases cardiovascular risk.
Oh, interesting.
Sorry, this person keeps asking. Some of these people spam the comments and but pulsatile tinnitus, is it more like brain or cardiac related? I don't know what that is.
I mean, there's a tumor called it's a glomus tumor, and it's you can feel your heartbeat from the blood vessel. You can feel your heartbeat from the blood vessel, which causes tinnitus and can cause pulsations in the ear. I don't know if that's what they're thinking of, but it's not something common. I mean,
can you operate on a family member, and if so, would you?
Yeah, well, I mean, my wife wanted me to operate on her for her lower back fusion, and I didn't. And my sister had neck surgery, and we talked about a long time ago on having me operate on her neck, and I didn't because, if anything ever went wrong, I think it would ruin our relationship forever. Because I think that person would still hold you responsible, even though you had no intentions of hurting them. If there was any complication, I don't think it's good. So for me personally, I won't operate on a family member. I have operated on close friends, but not a family member, because I would never want to ruin my relationship.
The exact same. I've operated on friends or parents of friends, but I've never operated on a family member. And I think the recommendation is that you don't, because it's very difficult to emotionally detach yourself in potentially, high acuity situations that could affect your decision making.
Especially if you have to live with that person, then face them every day if something went wrong.
But the thing is, I mean, it's not a good idea to, but You're allowed to if you wanted to.
You're
right?
allowed to, yeah. I had a partner in the distant past who operated on his wife, so.
This person put, does this, they're following up to the sauna question, I think. They said, does the same apply for a hot tub?
I don't think so, but I don't know that data.
Okay. Okay, looking outside of y'all's profession, what personal goals do the both of you have post your current career?
Post?
Yeah.
Yeah, but for me, we, you know.
Are you going to become a scratch golfer?
Well, definitely. Well, we always say we want to do things like I'd learn to like to play the piano and I want to get better at golf, but there's other things too. Like my son had died when he was 18 and we've become really advocates of, against drunk driving and things like that. So I want to carry on meaningful things into retirement that I can maybe even use social media that we can help educate people on things that we think are important. So that's probably where I'm focused for retirement. If I'm going to do something, if I'm going to do something that's meaningful to me, that's what I would do. Obviously, when I retire, I want to have fun too. I want to golf and relax and do the things I like to do. But if I'm going to do something that I think is beyond myself and meaningful to the world, that's what I'm going to do. How about you?
Yeah, I mean, yeah, I've got lots of hobbies and lots of things that I really enjoy doing that I certainly would like to carve out more time for. I do almost everything with my wife, and so that I really look forward to. For me, as far as like a secondary career, I really enjoy interacting with medical industry and medical device companies and working with those engineers and those physicians. I like being the dumbest guy in the room, because I learn so much when I interact with industry, and all they ever want is my opinion. And that's something that I seem to always have with me. So it makes it pretty convenient.
Let's see. Hardest test you've ever done?
Hardest,
Yeah.
like written test or just challenge?
I don't know. It's just his hardest test you've ever done.
I don't know. The hardest thing I've ever done is an Ironman. That was just both mentally and physically challenging. Took a year to train for. And you've done one, right,
I have,
Dr. London?
yeah, physically without a doubt. That was for sure the most difficult physical test that I've ever put myself through. How did you feel afterwards? Like what was next? When you finished it and you came home.
Yeah.
Like,
First of all, I think it's crazy that we've both done an Ironman. There's not that
that
many people
is,
out there in the world that have done Ironman, and we've both done one. But my goal was to keep in shape, right? So here I am. We've done this for a year. I'm in such good shape. My heart's great. Everything's great. And I'm thinking I'm just going to keep this going and at least try to do one of these every couple of years or something, and then gradually get busy again. And then I don't have one scheduled. And then before you know it, 3 or 4 years later, I'm not even hardly exercising. So that all went out the tube. So I had high aspirations to keep going at these, but they're so grueling. And looking back now, I don't even know how I found the time to do it with, doing what we do full time. But so I don't know. But I've done we've done half marathons and we've done some
Olympic
triathlons. Yeah, just haven't done another Ironman.
yeah. I mean, there's almost a little bit of a letdown, when it's
Yeah.
over, I
Yeah.
think, and you kind of have to get into that mindset of, okay, I want to do it again. And I got to that place and I mentioned that to my wife and she said, well, you have a choice. You can either do another Ironman or remain married to me. So,
Yeah. Well, maybe someday we could do a half Ironman.
there you go.
I think that's pretty doable, actually. It's not nearly as hard as the Ironman.
For sure.
Yeah. What do you want to do?
I don't know how much longer you want to do.
I'm good. I'm going to follow your lead.
Somebody said, if you won the lottery today, would you quit practicing medicine? That's a tough question.
Yeah, probably.
Yeah. I probably would
Yeah.
too. I mean, I might continue on education or do some consulting, but I probably wouldn't practice as hard as I do now.
You wouldn't do trauma call?
Yeah, right. Well, we only have so many years left here. So.
Any good tips for a new? We'll do a couple more questions.
Sure.
Any good tips for a new scrub tech? Or do you guys know?
Go ahead. I have something in mind, but let's hear what your thoughts.
Sure. Yeah. I mean, I think the most important thing, well, there's two really. Number one is the level of engagement with a scrub tech. You know, you almost have to have this sense of eyes on the back of your head as you're moving between your instruments in the field. You have to be very, very in tune with what's happening on the field and the steps of that operation prior to walking in the operating room. I think that's what happens a lot of times is scrub techs get flustered by worrying about like what's coming up step 3, 4, 5 and missing what's happening and trying to put things in the surgeon's hands that they're not ready for. So I think real engagement in the case is so critical. And the way that you do that is you study the steps of that operation so that, you know, even though you may work with different surgeons, getting from point A to point B is pretty much the same. And then you learn the innuendos of the individual surgeons.
Yeah. And I think exactly the same thing. I think the biggest thing I would say is pay attention to the steps they're doing. So if you're working with that surgeon for a while, the most frustrating thing for me is when I'm sitting there waiting for an instrument and they don't know what to hand me when they've seen it so many times. They know, you know, so really pay attention to what your surgeon, you know, needs instrument wise. But also on the flip side, don't take everything to heart that happens in that room. I mean, when a surgery gets tough and a surgeon gets snippy, they're not upset with you for the most part. They're upset with themselves because it's a tense situation. I've been there, and I'm not mad at the scrub nurse or anybody else. I'm just upset with the situation. And so if I get mad in surgery, it's not, you can't take it personally. I don't scream at people. I mean, there's nurses who end up crying because surgeons scream at them, and that should never happen. But there are times where you'll get moving along quicker because you need to. If you got bleeding, I need to move along quicker, and you can't take that personally if I'm trying to rush you through this a little bit, but I need stuff when I need it. So there's bits and pieces you have to be willing to accept that, you know, sometimes you're going to be hurried along because you need to be, but it doesn't mean the surgeon doesn't like you. It just, he needed that at that moment.
Yeah. Well, I never get snippy, ever. That's never happened for sure. I definitely do. And I think you're right. You have to have thick skin. You know, if you're going to function in the operating room, particularly in our rooms, you have to be willing to deal with, you know, high stress, high tension situations and not, like you say, take that personally.
Yeah.
Yeah.
That's a good question.
Mm-hmm.
Yeah. Someone put, as someone who's interested in neuro/cardiac and going into it, is work-life balance a major issue, or like having time with your family? Is that inevitable that you won't have as much time, or what are your thoughts on that?
Yeah. I don't know. I was just asked about this recently, and I was thinking about that because I definitely spent more time with my patients in my lifetime than I have with my family and my best friends. And I think that's something you give up what we do because we spend so much time in the hospital and so much time with our patients, our families pay for it. I think you have to have a wife who's very understanding, which my wife is, and she's always put my career first to some extent, which has always been wonderful of her and not fair, but it's how we have worked things out. And then the kids, I think, have always been very nice about, they understand that I've, you know, my job, and they understand that I haven't been there all the time for special events and sporting events. And I mean, it's when we do have time, we do fun things together. You know, when they were growing up, we always took trips and spent time with our kids, but you know, that time can be limited.
I totally agree. That's been exactly my experience. There, you definitely, unfortunately, your patients take top priority, and families frequently feel like they're second, even though that's not how you and I feel necessarily about. But the level of dedication requires that. You know, when my son Max was 10 or so, my dad, who is not a physician, asked him if he wanted to be a doctor like me, and his grandfather, and he said, "Oh no, Grandpa, I actually want to spend time with my kids."
Wow.
He was 10. Yeah, that hurt. That left a mark.
Yeah.
We make up for it now, though.
Yeah.
All right.
All right. Yeah, I don't know. Anything else? Any other interesting thoughts?
No,
Yeah.
I've enjoyed it
Yeah.
very much. Thank you.
So we hope everybody out there's enjoyed it. I mean, it's a lot of fun, and I'm sorry we don't get to all your questions. There's so many questions that come through. We just have to pick and choose, and then we go off on tangents a little bit. I understand that, but if you guys like this, leave us some comments, and maybe we can try to do it again here in the near future.
That'd be awesome. Yeah. And any topics that you guys are interested in too, that you want videos or newsletters or any of those kinds of things,
Yeah.
throw them our way, because it's really helpful to, to build our content and direct
Yeah.
it to the audience. So we really appreciate all that.
Yeah, maybe sometime we'll do like a who's smarter, a heart surgeon or a nurse. We'll get some questions thrown at us.
Wow.
Just can't be sports trivia because I'm not going there.
Yeah. I'd have to get my boys in the room to help me with that one too. Have a great night, Brian. Thank you so much. I really enjoyed it. Take care. Kevin, thank you.
Bye.
Appreciate it, buddy. Take care.